Jenny and Alex Inman were desperate for an alternative treatment for their son, Lucas. Doctors had recommended a second brain surgery to control seizures caused by severe epilepsy.
Rather than go back into his head, we were going to try this oil that came from a plant and see if that helped at all.
The Inmans moved to Colorado in 2015 to obtain legal medical marijuana, including cannabidiol.
There you go.
Known as CBD, a compound in hemp and marijuana that doesn't get users high.
You think it tastes a little bit disgusting?
The Food and Drug Administration will soon decide whether to approve a CBD medication to treat rare forms of epilepsy, including Lennox-Gastaut syndrome, which Lucas has. It would be the first U.S. approval of a drug made from cannabis. But instead of celebrating, families like the Inmans are concerned. Lucas takes pharmaceuticals along with CBD and marijuana to help control his seizures. The fear is that a federally endorsed medication could push out small growers and sellers and end access to locally produced CBD.
If the kids that are benefiting significantly from that lose that, simply because there's one option through the formal channels, that would be a crime. That'd be a crime.
CBD advocates such as the Realm of Caring Foundation in Colorado Springs became alarmed when the drug maker, GW Pharmaceuticals, began lobbying state legislatures to change the legal definition of marijuana. The concern was new laws that could only allow a federally approved CBD medication.
We've been at this for a very long time, and people are getting success, and to block us from an option that's working for us, isn't going to be okay.
The company says it does not want to destroy the current market, but the changes are necessary so that Epidiolex can be sold in pharmacies if the FDA approves it. Dr. KNUPP is a pediatric epilepsy specialist at Children's Hospital Colorado. She says doctors currently can't prescribe CBD, and studies outside of Epidiolex have been limited.
I understand from a parent perspective wanting to try everything and feeling like you've done everything that you can for your child. So, when you hit on something that works well, whether it's science or magic, you're going to continue with it.
Yeah.
Megan Patrick uses CBD to treat seizures caused by a brain malformation in her daughter Adeline.
I know exactly what works for Addie.
She too moved her family from out of state to Colorado. For Patrick, the Inmans, and other advocates, the hope is that Epidiolex expands the use of CBD to treat epilepsy, not shrink the market to one medication. Peter Banda, Associated Press, Colorado Springs, Colorado.